of medication in Nigeria is off the roof, and it's quite disturbing. We've seen pharmaceutical companies leave the country due to many reasons they give, including the very difficult business environment. But beyond that, it's affecting citizens, and it may affect the well-being of a lot of people. People can no longer sustain just keeping up with their health, as well as it may eventually affect how long they will live as individuals. And it's a great concern for everyone, which is why we are having that conversation about the high cost of medication in Nigeria today on the show. So it's going to be a good time for you to be part of it. So on X and on WhatsApp, please send your thoughts as well as your comment, and we're going to read them as we proceed in the conversation. We're being joined from our Abuja studio by the president of the Pharmaceutical Society of Nigeria, Professor Cyril Usifoh, who is joining us from our Abuja studio. Professor, thank you so much for coming on the program.
Thank you for having me.
Prof, maybe I just gave a little analogy or what I encountered the other day right here in the office about the cost of drugs. And I know that there are a gamut of reasons or issues around this. But from your perspective as an industry player, my natural question will be, what exactly is going on?
Well, before I continue, let me quickly say that my heart, and indeed the hearts of all the pharmacists, go out with our citizenry who have been macheted or have lost their lives in the Plateau and other places in Nigeria. We sympathize and we hope this carnage will stop. Having said that, pharmacists are very, very disturbed about high cost of drugs. In fact, medicine security is an integral part of our practice. We are all part and parcel of what happened during the pandemic. And if you don't have adequate medicine supply, and if the citizenry, the vulnerable and those who can hardly afford their meals, get adequate medicines at the right time in the right dose, things become very difficult. The environment has also not been very friendly, and that's why we've had one or two multinationals leaving the country. But be that as it may be, I also want to say quickly that we need to look into ourselves. The prescribing and dispensing of medicine need to follow the national drug policy. We need to prescribe generic in favor of branded products that are definitely more expensive. And there are other reasons one can adduce. We don't produce most of our active pharmaceutical ingredients, the APIs, and the facilities for doing so is just beginning to come on board. Enzo Pharmaceuticals, for example, have started, but then we need more because we have the capacity, we have the wherewithal, but government have to be involved in producing this, especially with our petrochemicals. At the end of the day, we'll be a major supplier of these important API, the active pharmaceutical ingredients, not only in Nigeria, but to the West African sub-region, and indeed Africa, and could be a foreign exchange earner for the country.
Well, Prof, I'd like you to walk us through some of those drugs that have now become very expensive and beyond the reach of those who need them. And perhaps I could just give you a bit of a lead. Some category of antibiotics that used to be, well within the range of 2,000 naira, they're now said to be about 8,000 naira. What's the fate of diabetic patients, patients of kidney disease, patients of cancer-related disease? And perhaps you could also talk to us about, the cost range of their medications following this increasing cost of pharmaceutical products.
You you are quite right. The cost of pharmaceuticals, medicines have actually gone up. This is not unconnected with what the prevailing situation in the country. The industry player falls into the same fate like many entrepreneurs. Like I mentioned earlier, most of the ingredients for compounding medicines are actually imported. So you are faced with the situation of getting the necessary foreign exchange to import these important ingredients to formulate your product. And of course, if you buy from the same market and the exchange rate of the naira to a dollar, for example, is skyrocketing every day, that definitely will affect the price of medicines. Additionally, we also have basic infrastructure. I call them basic. Energy is a problem. Most industry players have to get their own water. They have to produce their own energy, electricity. And most of their plants run 24/7, and they have to buy diesel at high prices. Additionally, we also have debt of pharmacists to man some of these centers. The so-called Japa syndrome has also affected the pharmaceutical industry, where many pharmacists live day in, day out of the country for greener pastures. Additionally, we also find out that road infrastructure is also problematic. I visited Abara, and I found out that though the companies there have products and they are doing their work effectively, but by the time they get their raw materials or evacuate the medicines to where they are needed, most of their trucks break down on the road because the road is in a terrible state. Now, we pay most of the time out of pocket for medicines in this country, and that is not good for the average Nigerian. I believe the National Health should come in. Insurance agency should be able to, we should fast track that, especially with the implementation stage. Right. And I must commend the coordinating Minister of Health for bringing that to bear. We talk about implementation so that the average Nigerian can participate and get medication that's lower cost.
And that's a very important point you have made. The average Nigerian be able to get access to medication. People have said if you're falling ill at this time, this is the wrong time to fall ill or to go to the hospital or go to the pharmacy. And I'm sure you've seen people say that. So a lot of people are wondering, what would I do? Do I seek alternative medication and the rest? But, the question is, and that ties to what Bukola and Jeffrey have asked. And you had earlier said that, prescription and dispensing of drugs should follow the national policy. You said that we should stick more with generic rather than brand. So are you saying that some people, when they prescribe medications and dispense, they choose to give people the expensive brands? Are you saying that they're actually drugs that are within our reach? Because we know that it's also a business at the end of the day. So are you saying that there's actually a push for these expensive drugs to be the ones that are right there in the front of people and they are cheaper alternatives? Is that what you're saying?
Absolutely. Absolutely. I believe strongly that the national drug policy should be adhered to, and I am confident that the coordinating minister will also push for the implementation of that. And you can't compare the price of generic that are as active as the branded to the branded. Some individuals like the branded, but I think for affordability, we should look at generics. And when you carry out what we call bioavailability studies and bioequivalence studies, they have the same potency. And I'm sure when our dispensing pharmacists and our prescribing physicians adhere to these, that will bring down the cost of treatment, and that probably will help us. I'm sure the National Health Insurance will advocate for generics and not necessarily branded products.
I wanted to find out what conversation the association is having with government as an immediate intervention, because sickness or diseases will not take a break because drugs prices are high. So is there a conversation going on between the association and every stakeholder involved to see what can be done? Because the shock is quite high.
Yeah, there are conversations going on. I've had the opportunity of engaging the Honorable Minister of Health and coordinating the Honorable Minister of Health and Social Welfare. And one of the things I must commend the government for is restoring funding to regulatory agency. This is one way forward of making sure that not only do we have drugs that are effective, we also prevent fake and substandard drugs from coming to our environment. I want to quickly say here that apart from the high cost, when medicines are high, people tend to look for lower ones or lower costs, and they may fall into the hands of buying fake and substandard drugs. And NAFDAC have been working very well in this regard. But I must tell you that drugs can be, or medicine can be made in other countries, and if the borders are not well policed, they find their way into the country and becomes a problem for us. And treatment outcome becomes a terrible thing. And this is one of the frustrations the physicians have in their clinics when medications are given and they are not effective. I think together with the funding, they should be able to police, and I also hope that the fake and the bill on fake and adulterated medicine act will be properly revised such that NAFDAC and the Pharmacy Council of Nigeria can work together, and they'll be properly and adequately followed up with necessary security, because people who do these things are well militarized in their own way. And I'm confident that when we have that, things will become better. But at the same time, I also believe that there must be that close network within the health sector. It's a family to be able to approach these things we are talking about. And I'm confident that even in the federal institutions, where tertiary institutions, we'll be able to follow up all these medications appropriately. Let me quickly say here that if the primary healthcare sector is well strengthened, like the coordinating minister is saying, that would actually forestall some of these to the hospitals, especially tertiary hospitals, for treatment.
You're quite correct, Prof, and that speaks to promotion of preventive healthcare rather than curative healthcare. You talked earlier about generic drugs versus branded drugs. I'd like you to provide a bit of education there. Do generic drugs run through the category of healthcare conditions that affect Nigerians generally? I hope you catch my drift. Then in terms of intervention, Prof, I don't know what your engagements are with the federal government, but can there be applications to the government to the extent that they can provide foreign exchange intervention to importers of pharmaceutical products, such that, because it's a critical sector that affects public health, particularly for those who are facing terminal health conditions?
I agree with you. The branded product we call innovators product. These are products that the people that probably brought the drug to the market, and a timeline is normally given for them to recoup the funds they have committed in providing this innovators product. And now when the time is passed, other people have the possibility of making the same drug. And in fact, that's one of the specialties of pharmacists. That's my area of specialization. I have been, for example, engaged in some synthetic pathway of losartan, which is an antihypertensive outside this country, and we found cheaper way. And at the end of the day, you provide these compounds. They are not innovators product, the branded product. They are generics. And as generics, you must compare them with innovators product. And before it comes to the market, it follows all the necessary procedures and the R&D such that it can be substituted for the branded product. We are saying that federal government has said that as much as possible, prescribe generic products. That will bring the cost of drugs down. Now, concerning government, we've engaged government, and we are still engaging government, and we still intend to engage government in the next few weeks. And I probably would plead with you to be a little bit patient, and so some of the engagements that will come up in the next 1 or 2 weeks will unfold better things that will make the cost of drugs come down.
Okay.
I have confidence in that, yeah.
All right, so 2 things I heard from what you said. Well, more than 2 things, but when you talk about prescription, the physicians prescribe, the doctors prescribe, and then you talked about dispensing. The pharmacists, they dispense. So obviously you're saying the doctors should be, I don't know, more circumspect, as well as the pharmacist in their prescription and dispensing. But help us as we wind down, Prof. I go to the hospital, I get a prescription naturally, and then I go to the pharmacy, and the drug that has been prescribed to me is what was given to me, something I bought for 15,000 or 10,000 naira some months back. Now it's 50,000, either an antibiotic, inhaler, or even a painkiller, as simple as a painkiller. What do I do? And I have that, they will say I rejected that, but I'm going through pains at that moment. So what do I do as a person? Do I seek alternatives that was not prescribed for me? Or what exactly do I do? Let's help Nigerians this morning.
No, what you do, like I said, there needs to be a discussion, a conversation with the health team. If the physician prescribes and the pharmacist gets the prescription to dispense, I'm sure the pharmacist should be able to talk with the physician if there's an alternative, a generic product different from what he has prescribed. And then both of them can send the patient back to the physician after the conversation, and they can change the prescription.
But as a patient, can I do that as a patient, Prof? Pardon me. So are you saying as a patient, I should go back to my doctor and say, you need to prescribe something cheaper?
Yes, you can. The patient must be involved in the total health care. In fact, the patient should know what drugs are given to him. The patient should be able to complain. The patient should be able to tell you how he feels. The patient should be able to also let you know his financial position. And that's exactly what we're talking about. Why would I get a prescription for a drug I cannot afford? I think the patient, other members of the health team, whether the physician, pharmacists, and nurses, we should all come together so that we can build a treatment pattern that will help the average Nigerian overcome whatever disease that he has. Prof, let me tell you sincerely,
Go ahead, just land on your thoughts, sir.
Yes, I just wanted to say that there are some debilitating diseases. There are some issues, people who have to regularly fill their prescription. Maybe a particular brand has been prescribed, and that brand is no longer available. It is a responsibility of the pharmacist to get in touch with the physician to say, this brand you have prescribed, or this particular medicament you have, medication you have prescribed, is no longer available. There is an alternative that is as effective as the one you have, with enough data and evidence, and that would help the average Nigerian.
All right, Prof, just if you can answer this in 30 seconds as we wrap up. Clearly, the leaving of GSK and others is indicative of the fact that we don't have drug security. That's simply what this means in clear terms. It means we don't have drug security. So I'm wondering, as pharmacists, as an association, are you now thinking of maybe talking to some investors in other sectors to begin to look in the direction of pharmaceuticals so that these products we can begin to have this level of drug security, so we don't have these shocks that we're experiencing in our economy? Just 30 seconds. This time investors, not government.
I said 2 years ago, the topic for my conference was medicine security. The industry players are willing. Thank God government says 40% of drugs should be produced at home. The policies and everything are in place. Although when government was doing that, they didn't invite the stakeholders. The industry players are willing and have the capacity to do and produce drugs that will be available. What we need, like I said, in the next 1 or 2 weeks, you will hear from the pharmaceutical sector what exactly we've been discussing with government and how we can to bring drugs down. I'm sure it's not impossible to have a zero tariff for drug products and its auxiliaries. especially the APIs, so as to bring drastically the cost of drug. For example, we are working closely with government on that.
Thank you so much for your thoughts and insight. Professor Cyril Usifoh, President, Pharmaceutical Society of Nigeria, joined us from Abuja studios to give us a perspective on the high cost of medications in Nigeria. Thanks, Prof, for coming on the program.
Thank you for having me. Thank you very much.